Good evening, everyone, and welcome to another hour of Healthy Conclusions, where we try to give our listeners important information on nutrition, exercise, holistic, alternative, and integrative medicine. Please take a minute to visit our website at www.healthyconclusions.com and like us on Facebook. My name is Bob Neugebauer, and I will be your host for this evening's show. Tonight's show is being brought to you by Altrua Health Share, which has been serving its members and their families with their health care needs since 1997. Please take a moment to visit their website at altruahealthshare.org or call 888-244-3839 to see just what Altrua Health Share can offer your family for their health care needs. It could mean substantial savings. This evening we have as our guest Gabrielle Anderson. Gabrielle earned her master's degree in acupuncture and East Asian medicine through Bastyr University in Seattle in 2009. She's a diplomate in acupuncture through the National Certification Commission of Acupuncture and Oriental Medicine. After completing her clinical training at Bastyr Center for Natural Health, she traveled to China for an internship and did extended training at Long Ho Hospital?
Longhua Hospital.
Hua. See, I'm not Chinese yet, but I'm getting there. One from column A, one from column B. Through the Shanghai University of Traditional Chinese Medicine. She has worked in acupuncture in the division of Harborview Medical Center's International Medicine Clinic and Chronic Fatigue Clinic in Seattle. She has specialized training in detox protocols according to the National Acupuncture Detoxification Association in order to help patients quit smoking and other addictive habits. She is certified in NAET, an allergy elimination technique. You've got an awful lot of credits behind you there, Gabrielle. But before we start this evening, I want to confess that I did have my first acupuncture session yesterday with Gabrielle and found it quite painless, contrary to what most people might think. I also found it quite relaxing and stress relieving. So thank you for joining us this evening, Gabrielle. One of the big issues facing our country today is one of how do we solve the problem of chronic pain without the use of addictive opioids. I think most of our audience is aware that the President has declared war on opioids. And in July, his Commission on Combating Drug Addiction and the Opioid Crisis issued a preliminary report urging the President to declare a national emergency under either the Public Health Service Act or the Stafford Act. Doing so would allow the administration to waive some federal rules and put pressure on Congress to provide more funding. The report also calls for the development of non-opioid pain relievers. Now, much of this is political bluster, except for the fact that 60,000 Americans died of overdoses last year, and the number is expected to be even higher this year. So let's start off with this. You deal with helping people manage chronic pain on an everyday basis as a licensed acupuncturist. Do you find that in most cases you are able to relieve most of your patients' pain or at least give them some sort of relief?
Yeah, so most of the patients I see seek acupuncture for some type of pain relief, whether it's lower back pain, neck pain, headaches, migraine, sports injuries, injuries from a car accident, etc. Majority of people find some kind of relief. The main difference is how quickly do they respond. Some people feel relief right away, whereas others might need a few treatments to gain some momentum and break through a plateau of chronic pain. It's fair to say if you've had chronic pain for 20 years, it's probably going to take longer to get results than somebody who had a recent injury and is in short-term acute pain. The type of pain and the cause of pain will affect how well the treatment works and how long it takes to get relief. But as I begin to work with a patient, I get feedback from them about what they're feeling, what they're experiencing, and what kind of results they're seeing. And this feedback helps me really fine-tune their treatment as far as which points I select to address their specific type of pain and symptoms. And typically as treatments continue, they have a cumulative effect, and the pain relief lasts longer and longer between treatments.
What's your typical patient like when they come in to see you? I mean, are they just the run-of-the-mill people? Are these people from the high end? Because we know that most of the time naturopaths or anybody in a complementary alternative medical field doesn't really get any reimbursement from insurance. So they're coming to you. They're looking for a service to help them where they haven't found help elsewhere. They probably already paid a lot of money, but again, they get insurance reimbursement, and somebody gave them a pill bottle and said, go home and get well. Mm-hmm. So what type of people are coming in to see? Are these ordinary people or high-end people, or where do they come from?
You know what? It's actually a pretty diverse group that comes in. It's surprising, actually. Like you said, a lot of these people, they've tried everything. They don't necessarily want to try acupuncture. Most people are a little nervous about it. They're a little scared of it. They're not really sure how it works, but they're desperate. And they've tried so many other things that didn't bring relief, or maybe only gave temporary or short-term relief. And they're looking for answers and kind of desperate and willing to try anything. So most of the people I see have already been to a lot of other healthcare providers before they make it through the door. That being said, I wouldn't say they're the specific demographic. I predominantly see adults. I predominantly see people coming in for pain relief. But it's also excellent for people seeking stress relief, hormone balancing treatments, help with insomnia, help with anxiety or mood disorders. So there's really a wide variety of people that come in seeking acupuncture.
Do you find a lot of people coming to see you for depression issues?
I do, yes. I have quite a few patients coming in for treatment of depression, different types of depression, whether it's seasonal affective depression or post-traumatic disorders or chronic depression. It varies quite a lot, and then the treatment for that varies as well.
The reason I asked the question is, we've had a lot of conversation about these mass shootings and how psychotropic drugs have actually played a part in some of these. When your patients are coming in, have they been through these drugs episodes prior to coming to see you, and you're kind of a last resort?
Most people have tried some kind of drug therapy prior to acupuncture, and either it wasn't helpful for them or they're just not happy with the side effects and they're wanting to find another answer that has less of those negative side effects, whether it's affecting their sleep patterns or their digestive system. Some people are just ready to try to wean off of those drugs and find an alternative.
Do you find any particular malady more receptive to acupuncture than others when you're dealing with these patients?
Well, again, pain is a big one just because acupuncture is so helpful at stimulating the release of those endogenous endorphins in our system. It has a strong effect on the central nervous system. So it's one of the first effects people feel is pain relief and stress relief. It's very calming to the nervous system and helps shift us out of that fight or flight stress response back into that parasympathetic state where our nervous system can rest, relax, and actually focus on healing. That's a big reason why it also helps with sleep and why it helps with mood, because of those neurotransmitters like serotonin and dopamine that get released by the pituitary gland. It helps people kind of get that almost like a high, like they talk about a runner's high after exercise. It's a similar feeling to that.
Would you say pain is that sleep is probably the second biggest issue along with stress when it comes to dealing with acupuncture?
Yes, I would say pain and stress are the top ones, and then the manifestations of stress. For some people, that their sleep gets off when they're very stressed. For some people, they get headaches. For some people, their digestive system has problems when they're stressed, or their skin. So it's typically pain, stress, and then the manifestations of that stress.
So when they come to see you, they've already gotten off their pills in most cases, dumped them down the sewer or in the toilet, and are well on their way saying, what do I do next? So again, it comes down to the fact that people like yourself are out there in the complementary and alternative medicine field, but you wind up getting to be the last one on the line because there's no payment for insurance. Is that correct?
Perhaps. That's probably part of it. I think that's a part of people's hesitation in coming to see me is if they do have to pay out of pocket, certainly that holds them back. And many people have told me, had this been covered, I would have come in a lot sooner. Sometimes it actually takes a referral. I've actually had patients referred to me by their medical doctor who realize we're not getting anywhere. I don't want to keep giving you more pain meds. They're not resolving the core issue here. We need to get to the root of the problem. So I've actually had referrals from medical doctors who are starting to recognize the benefits and recognize the limitations of those pain medications.
So you're actually seeing a shift take place?
Yes.
Is
Yeah.
this something that's just kind of been recent? Because we know this shift is taking place in the inner circles, and a lot of that is pressure because of this war on opioids, and a lot of that is also pressure because of the attorney generals having problems in all these states with the opioids. Do you think that is the reason they're pushing towards you, or they just cannot solve the problem?
I think it's a little bit of both. I think the big picture that we're hearing about is this pressure, and the studies coming out showing how many deaths from overdose and this huge problem. But on a personal level, my experience with doctors has been they feel frustrated that they can't do more. At least the ones that have referred to me, they've told me that, I have these patients come back, they have temporary relief, they come back, they want more, they need a higher dose to get the same result, and they get to a point where they can't prescribe a higher dose. It wouldn't be safe, and then they feel stuck, and they feel frustrated that they can't do more for the patient, and the patient's frustrated that they're in the same position now because they've built up a tolerance to that pain med. So in my experience, I think it's coming from a place of most people in healthcare, we genuinely get into it because we actually want to help people feel better. And it is frustrating to a point where you're not able to do as much for your patient as you want to. And it's better to refer to someone who can help them in that arena, just in the same way that if I had someone come into me with a trauma wound, of course, that's not the right place to go. I'd want to refer them to a surgeon to address the problem. So I think it's working together and focusing on those areas that we're good at, where we're effective, and getting people to the right provider for the right thing.
We're going to have to take a quick break. We'll be back in a few minutes. You're listening to Health Conclusions, brought to you by Altrua Health Share, with your host Bob Neugebauer on 580 KIDO AM and 107.5 FM. Welcome back to Health Conclusions on 580 KIDO. We're speaking with Gabrielle Anderson, a licensed acupuncturist, sponsored by AltruaHealthShare.org. All right, so we were talking about reciprocation with doctors that have recommended or referred patients to you, and you do see that changing slowly but surely. And the principal reason that you don't see a lot more of it, I presume, and you have said, is because of the insurance reimbursement, which, in some cases could be quite substantial, depending on how many treatments somebody has. And speaking of that, a couple of things. What are the most common modalities that you are faced with treating? And what is an actual amount of visits that it would take somebody to get some kind of a change to take place in themselves, that they know they're getting better?
Mm-hmm. Well, unfortunately, there's not a black and white answer. It does vary from person to person. But typically what I recommend when people come in is to aim for a set of about 4 treatments initially, because sometimes people notice results after that first treatment. Right away they start feeling better, and then we just build on that progress. But some people have an experience where it's more like breaking through a plateau, and after maybe that 3rd or 4th treatment where they've been noticing hardly anything, maybe all of a sudden they get huge results. So I would say more often it's a gradual progression of improvement, but usually after about 4 treatments, we have a pretty good idea of how someone is responding, and then I can reassess and make an estimation of how many more treatments they might need and how often they might need to come to fully resolve their problems.
Do you find that dealing with the addictive patients is more difficult than those that have just stress or depression or something like that have not been addicted to something?
I wouldn't say more difficult in dealing with. In dealing with addictions, usually the main holdup when people come in is if they're truly wanting to make a change and they're ready and they're mentally committed to that change, we can make some really quick progress. If there's anything that's still holding them back, it's not really ready for that change or ready to let go of that addiction, there's nothing I can do to overcome that. But physiologically, if their body is having cravings, whether it be for nicotine or a drug, the acupuncture really helps with those biochemical changes and cravings so that it's not as hard to resist.
Okay. Can you explain, just in in layman's terms, to our audience, what is it that acupuncture does that actually changes the biophysical parts of the body or changes the way people are feeling in their body?
Right. So acupuncture is really good at working with your central nervous system. So it has a multitude of effects, part of which is shifting you out of that sympathetic fight or flight stress mode back into a parasympathetic relaxed state. But it's also stimulating the release of those endogenous endorphins, like we mentioned earlier, and creating that pain relief, our body's natural ability to fight pain. So another way that it helps is by reducing inflammation. So they've done thermographic imaging and been able to show over the course of a treatment those changes happening in the body where that inflammatory response is markedly decreased. And because inflammation plays such a huge role in different types of pain, I think that's a big part of why it's able to help so many different types of pain.
So when you talk about inflammation, we often hear about autoimmune diseases and inflammation of the digestive system. Aside from the normal bumps and bruises that we get, especially in the athletic world, how do you contend with the problems in the digestive area, which basically is about 60 or 70% of our immune system?
Exactly. So this is part of the area where I'm hoping they'll continue to do further research on acupuncture, because we've been able to see the results that it can help with irritable bowel syndrome, it can help with bloating, it can help with nausea, and they can see these results, but we're still trying to understand beyond just the effect on neurotransmitters and inflammation, what else is going on that's causing these improvements in these results. There's a lot of hypotheses out there, but we need more strong scientific research to help people understand, because it is science-based. We just need a way to understand it better so then people can accept it more easily.
So do you actually talk with other functional doctors or naturopaths when you're working with a patient, especially if they've been referred, as to what the procedure is going to be to treat them? Because sometimes I get from the allopaths, well, you guys really don't have anything science-based. You don't know what you're doing. And I know that's not true.
Yep. So when I was working in Seattle, I had a number of doctors that would refer patients to me. And in my experience, I would always follow up with them after the referral to let them know if the patient came in, what did we do in the treatment, what did we address, how did they respond to the treatment, and what our treatment plan was going forward. And they always really appreciated that follow-up, and they appreciated me explaining what we had done and what was helpful. And I just find that working as a team is always better, whether it's with medical doctors, naturopaths, chiropractors, massage therapists. Working as a team is going to get people the most results the fastest. We all have our areas of specialty, but we can all work together.
And you find that expanding?
I do. Yeah, I really do. The clinic I worked at in Seattle, we actually most of us were under the same roof. And then a few people were outside of our clinic that we would refer to. But here I have my own individual practice, so it's not under the same roof, but there's still that team approach where people come in and say, well, I've been trying chiropractic, should I do this instead? And my recommendation is usually, if something's helping you, keep doing it, and they're going to work in their area of specialty and I'll work in my area, and if we're working as a team, you're going to get better that much faster.
Did you find it difficult to connect with doctors down here in the naturopathic and chiropractic arena to talk with them and work with them?
I haven't. I've had a good experience here, and excuse me, I'm still fairly new to the area, so I'm still getting to know the community and network, but I've already met a number of other integrative and natural health care providers that have been referring people to me, and they're grateful to have an acupuncturist in the area that communicates well with them so they understand how it's benefiting their patients.
I noticed yesterday you used tuning forks on the needles when I was lying there on the table being your experiment, I guess, for the day. What function do they play in the acupuncture? And why is there a 24-hour delay before you actually feel some effects of the treatment?
So I'll start with the tuning forks. How I use those isn't really part of Chinese medicine specifically, but it's using the idea of vibrational fields and the fact that sound and vibration from any source can have beneficial or detrimental effects to our well-being as a whole. And when we come in contact with different sounds and vibrations, depending on the source, we start to resonate at that frequency, whether it's positive or negative. And so our cells are resonating at that frequency, and using the tuning forks is a way to introduce a more beneficial positive frequency so that that vibration gets your cells mimicking it, and then you start to have this more balanced frequency where you can maintain health and it makes it easier to heal. Stress is a different frequency, pain is a different frequency, and these are all frequencies that our cells start to match whether or not it's beneficial. So the tuning forks are a way to introduce something that is beneficial and is going to promote wellness and healing. As far as the 24-hour delay, I should clarify it doesn't necessarily take 24 hours to feel the effects of the treatment. For instance, if someone comes in with a headache, often they leave without a headache. But the 24 hours is that window when you're going to get the full benefit of the treatment. Because Chinese medicine looks at the body in terms of these energy pathways called meridians, which tend to overlap with our nervous system and our connective tissue system, our lymphatic system, the treatment is traveling through all these little energy highways. And because there's 12 meridians, the ancient texts talk about this 2-hour window for each meridian. So it takes that full 24 hours for your entire system to integrate the messages that we sent during the treatment. So while you'll probably feel some benefit before then, it's that 24-hour post-treatment when you're going to get the full benefit.
We're going to have to take a quick break. We'll be back in a few minutes. You're listening to Health Conclusions, brought to you by Altrua Health Share with your host Bob Neugebauer on 580 KIDO AM and 107.5 FM. Welcome back to Health Conclusions on 580 KIDO. We're speaking with Gabrielle Anderson, a licensed acupuncturist, sponsored by AltruaHealthShare.org. Okay, so we're talking about how the body responds to frequency resonance. Is this something new that you have fallen upon, or is this something that's old school? I'm just kind of curious because I know a lot of the naturopaths use frequency resonance in a lot of their therapies.
Yes, so I wouldn't say it's something new, but it's not something that I studied as part of Chinese medicine. It was an additional course and certification that I took that I thought would integrate well with the acupuncture treatments. There's different ways of using frequencies, and I think some naturopaths use them for addressing, bacterial infections or viruses, but I'm using them more in terms of placing the tuning forks on specific acupuncture points to stimulate and get a heightened response from that point.
You spent a lot of time in a specialized sports clinic where you had an opportunity to treat professional athletes, from runners to triathletes and even basketball and football players. Do you think the athletes are spending more time being treated by alternative and complementary practitioners now, such as yourself, because of the use of less invasive means of healing?
Yeah, I think that's part of it. Professional athletes tax their bodies in such extreme ways on a regular basis, and unfortunately, part of their job often includes getting injured from time to time. And they need to find ways to not only feel better, but actually heal quickly so they can get back and continue competing. More importantly, they often don't want to be dealing with side effects of drugs or be set back by a recovery time after more invasive treatment methods. And I've even had people come in for acupuncture when they've been told the only option left was back surgery, and found that with ongoing treatment, we were able to actually resolve the pain or the issues they were having, whether it's sciatic nerve pain or herniated discs. So that's not always the case, but I've seen some really good results, and they're thrilled to be able to get a treatment that helps them feel better without side effects that might hold them back from competing in their sport. I think another benefit is that because it helps the body deal with stress, which their job is fairly stressful on their body, they find that it results in better performance. And many of them would say they came in just for maintenance and wellness treatments because they found they got injured less and got sick less often.
The HHS says that between now and 2025, we're going to see 3+ million Americans have knee replacement surgery. Mm-hmm. It's also noted that almost half of these people could be treated with acupuncture, saving the country, or saving Medicare, Medicaid, well over $2 to $3 billion in costs. Mm-hmm. Have you found that you have been able to help people who have had problems with their knees and need replacement?
Yes, I see quite a bit of knee pain actually, and oftentimes it is people who have been told they need either a partial or full knee replacement, and either they just can't afford it or they're not ready to take the leap to have a major surgery, or they're just hoping that they'll be able to delay or avoid that altogether. And I've seen really good results with people as far as pain relief, reduced swelling, again, reduced inflammation. They find that with that reduced swelling and inflammation, there's typically better mobility. That being said, if there are physiological changes in the joint, and there's sometimes people are down to bone on bone, it can help with pain, but it's not going to change the fact that there have been structural changes in the joint. So those cases can be tricky to address. But typically, I've found that people can either really delay having to pursue surgery, or in some cases not require it at all. In some cases, it was a premature recommendation.
Well, by delaying surgeries, which we all know are very invasive, is it possible to recover from this type of a problem through the use of, taking collagen and different proteins, things that will help rebuild the cartilage and ligaments in that area?
I think it is possible. I think, it depends on the case and the patient. It depends on what all they have tried already. If somebody isn't already doing those things, if they're not taking supplements that could help with joint repair, if they're not already incorporating some of these things, I certainly recommend that first. And I see what kind of progress we can get in that area. And sometimes the results are fantastic. Sometimes cases don't respond as well, and everybody's different, but certainly before jumping straight into surgery, I recommend trying supplementation, making sure your diet isn't pro-inflammatory, and mitigating stress or impact on the joints so that they can try to heal.
When we begin treatment of a patient, how important is it, do you think, to know what types of supplements and diet that they've been ingesting? And do you ever prescribe change of diet or any sort of supplements to help with the healing process?
Yes, so that's something I always discuss with new patients. I like to get an idea of what their diet is like, if they are taking any supplements or vitamins, what they may be, and if they're open to making any changes in that area. Some people aren't and some people are, but it's certainly an important place to start. Our diet and supplementation are part of our lifestyle that's influencing how we feel on a daily basis, and that's really the foundation of health. And while acupuncture can help, if your diet is off or your lifestyle is extremely stressful or you're not sleeping well, those things are all going to have detrimental effects that make it much harder to see progress. So I always try to talk with patients about changes they could make that would be beneficial to them. And sometimes people aren't interested, but most of the time people are really receptive once they understand how it relates to the problems that they're having and how it could really help. And really, that's something you're doing on a daily basis between treatments that's going to have a really powerful effect.
Well, I know most of the people in the complementary and alternative medical field, even the integrative field as well, consider nutrition to be the base of wellness. And if you ask a naturopath, what's the difference between him and an allopath, he'll say, well, with the allopath, it's here's a bottle of pills, go home and take these. And with the naturopath, you realize this is going to take 90% on your part to fix yourself.
Yes, there's a lot. There's a lot of effort required on the patient's part, which is good news and bad news because it allows you to be proactive about your health, but also requires you to take action.
Well, keeping that in mind, do you find any particular age group more or less receptive to acupuncture treatments and the things that are necessary for them to do to get well?
You know, I have worked with patients ranging from infants to the elderly, and I've honestly been amazed at how acupuncture has been able to help people of all age groups. That being said, the treatment approach is different when you're treating an infant or a child versus an adult or an elderly person. I think, you know, someone with robust health that just has had an injury is going to be able to respond to the treatment quicker and more easily than someone who might have a lowered immune function or depleted energy. It may require more support for them to start to respond to the treatment. And how I treat that individual will vary as well, just because a child or an elderly person is not going to require as many needles or as long of needle retention time as, say, a healthy adult.
Well, they say when you're older, everything slows down. Wouldn't that dictate that it might take a lot longer for older people to react to acupuncture therapy?
Yes, it can. And in acupuncture, we talk about the qi that's flowing through our body and how that can become deficient. It's just, if you think of qi, you think of energy. So over the course of our life, we gradually deplete our energy reserves. And a young adult is going to have more of those energy reserves than someone who has been alive longer. So it could take longer just because they're going to have more deficiencies that need to be replenished.
What do you find most challenging about being an acupuncturist?
You know, probably the same thing that I love about it, which is that it's been around for thousands of years and has a rich history, but that also means I will never stop learning. There will always be more to learn. There will always be more to understand, more ways that I can improve what I do. And that's also what makes it most exciting, because I'll never be bored and I know I can always improve my practice. So it can be kind of overwhelming to think about the history and all there is to learn, and that can be challenging, but that's also what I love about it.
We're going to have to take a quick break. We'll be back in a few minutes. You're listening to Healthy Conclusions, brought to you by Altrua Health Share with your host, Bob Nugabar, on 580 KIDO AM and 107.5 FM. Welcome back to Health Conclusions on 580 KIDO. We're speaking with Gabrielle Anderson, a licensed acupuncturist, sponsored by AltruaHealthShare.org. So we're talking about the difference between treating older or younger people, and you don't seem to find a lot of difference with either, or that people respond as they're going to respond. When you're dealing with an older group, do you find them more skeptical of treatments, or do you find them more acceptable of alternative treatments?
You know, I've actually seen both. I think there is always a little skepticism on the part of patients when they come in for acupuncture, just because it probably hasn't been explained well to them and they're not sure exactly how it works. But that being said, once they experience the treatment, it speaks for itself, and that skepticism usually goes away pretty quickly. It's just that initial encounter where some people aren't really sure what to think about it.
Acupuncture has become, in many cases, a new way to relieve the chronic pain that people have been having, and is now being accepted as primary therapy at VA hospitals for chronic pain and PTSD. Do you believe at some point in time the medical and insurance community will lose their stubborn streak and learn to accept acupuncture as a genuine science-based medical treatment? And we see the VA is now hiring acupuncturists in G9 and G12 positions, which are pretty big positions, to work in the hospitals, yet we can't seem to be able to get reimbursement for what our government, at least the VA, believes is science-based medicine that works.
Mm-hmm. You know, I see a little bit on both sides. So to some extent, I see more acceptance, especially on behalf of doctors referring patients for acupuncture. I think the insurance side, it's lagging a little behind, but it's getting better. When I worked in Seattle, I actually probably about 90% of my patients were paying me directly through their insurance coverage. That being said, that's just a small part of the nation. And I know that what we need is probably more science-based research. Acupuncture is science-based. We just have yet to help prove how and why it works. We know some of the mechanisms, but we don't know all of them. And I think the more we can verify that and the more studies we can do, the more accepting they'll become, because truly it's a preventative medicine as well. And even if they're just looking at numbers and money, it can help save them money when people can avoid costly or invasive procedures.
Well, we all know that that's not the goal of the insurance companies nor the drug companies. In most cases, not even the hospitals. Mm-hmm. The most expensive way to do things is always the best way for them. I found that to be true through my many years of life. Mm-hmm. But I was more curious, is if somebody is referred to you by a doctor, especially an allopathic doctor, mm-hmm. will the insurance tend to be more lenient in paying you than if they're referred to by a naturopath? It
really doesn't make a difference because people don't need a referral to come see me. If they have insurance coverage, they have insurance coverage, and if they don't, they don't. So unfortunately, a doctor referral doesn't give someone any better chance of it being covered by their insurance. It helps get the patient through the door. If they were somebody who wasn't interested in acupuncture, oftentimes a referral from their doctor makes them feel like it's a legitimate form of medicine, but it doesn't necessarily mean the insurance will be more willing to reimburse for it.
Well, you just kind of reaffirmed something that I read from a symposium that took place about 2 years ago, which basically stated that the same thing you're just saying here now, is that they really don't want to pay, but until they are forced into it, I think, we're not going to see any real change. And what really disturbs me more than anything is that we have a shortage of physicians. Even here in Idaho, they say we have a shortage. We have about 409 physicians that are retired here in Idaho. They're retired because they can't afford the malpractice insurance. That's why they retire. So they lose money every year when they're taking care of Medicaid patients because they don't get enough reimbursements from them. However, we have well over enough practitioners in the alternative and complementary arena that could fill in for these doctors, bringing us into what I would call an integrative medicine state, where you've got the allopaths working with the naturopaths and the chiropractors and the acupuncturists. Problem is just getting everybody on the same page.
Exactly, and recognizing that we all have strengths and weaknesses in our different areas, and if we work as a team, the patient will benefit because now all of those needs are getting addressed, and we're all doing what we're best at.
So you find that they are working, at least with you, in the community?
Yeah, on a personal level, that's been my experience. I've had, and I have had medical doctors that come see me for treatment because they're so happy with the results, even for themselves. And then also lots of referrals, sending their patients to me, especially, I would say the majority of them being either sports injuries or pain relief cases where a doctor feels like, all I really have to offer you is, some opioids or pain medicine, which isn't really going to resolve the problem. And you're going to build up a tolerance and need more, and then there's going to be a certain point where there's nothing more I can do for you. So my experience has been they're usually happy to have someone to refer their patients to who can actually help them feel better. So I've had a good experience with that.
As of the first of the year, the group that basically rates hospitals has required them, as of January 2018, to have an integrative chronic pain medical team on board in-house. Mm-hmm. Have you seen any of that happening around here? Have you heard any talk about it? I'm just kind of curious because I don't see that. I see them hiring maybe a chiropractor, maybe an acupuncturist, but I don't see them going full bore into integrative medicine. And this is what they're supposed to be doing, bringing integrative medicine into play to relieve this problem with chronic pain.
Yeah, I've seen some hospitals hire an acupuncturist or a chiropractor like you mentioned. Most of the full-on integrative clinics I've seen have just been, like you said, kind of individual, where people are paying out of pocket. It's not necessarily covered by the insurance or not necessarily being billed to insurance. And I think that's a problem, is because then it's a matter of, can people afford it? And they shouldn't have to choose.
Well, that's my curiosity here, because here they're asking and telling them to have an integrative team, but giving them absolutely no means to pay for it. So this is really kind of a false start for everybody. You can't use it if you can't pay for it.
Right. Yeah.
So what are they doing? They're blockading the complementary and alternative medicine from being actually used on a regular day-to-day basis. So to me, that's a useless situation. And it's just a lot of false promises by the hospitals and the government who are saying, hey, you should do this. 35 attorney generals have sent a letter to the American Insurance Association telling them they want to see insurance companies cover acupuncture and, in fact, integrative medicine, and they want it to be in the forefront of treating chronic pain to help their patients get off the opioid drugs. Again, do you see a lot of referrals from opioid drugs coming to you for pain relief?
I do. That's primarily what I get referrals for. Again, I wouldn't say a lot. I would say a lot of the referrals I get are for that reason. Most of the patients that found me on their own because they were frustrated or feeling like they were out of other options.
So you're out there kind of on your own with your little placard up there on that little house you're in, and hoping people recognize you.
Well, I get a lot of referrals from other areas too, from massage practitioners, chiropractors, physical therapists. So it's not always medical doctors, but it is the healthcare community in general, recognizing their patients' needs and where someone else might be able to benefit them more.
Could you tell our audience where you're located and how they can reach you if indeed they're interested in talking to you about treatments?
Sure. So I'm located just on the edge of the north end of Boise and downtown on 16th and Hayes. And it is at 1524 West Hayes Street in Boise. And my practice is called Nurture and Mend Acupuncture. And my website is www.nurtureandmend.com.
We'd like to thank Gabrielle for joining us this evening. If you missed any part of this evening's broadcast, you can find it in a few days posted on our website, healthyconclusions.com, along with contact information for Gabrielle and how you can reach her and make an appointment. Thank you very much for joining us. This is Bob Neugebauer saying good night until next Sunday, where we will have another hour talk about nutrition, exercise, alternative medicine, and integrative medicine. And we are sponsored by AltruaHealthShare.org on 580 KIDO AM, 107.5 FM.